Hi, my name is Lindsay Sward, and I serve as the Assistant Dean of Clinical Education here at UAMS. As a resident or faculty member working with medical students at our institution, you may be asked by a student to provide a clinical performance evaluation. Today, I want to briefly go over the performance evaluation instrument that we use here at UAMS and point out some key features. O2, or OASIS, is our student and curriculum management system. All of our evaluations are managed in O2. If a student requests an evaluation from you, you should receive an email alerting you that you have an evaluation to complete in O2. If you are unfamiliar with the O2 system, this email, which appears to come from Thomas James R. at uams.edu with the heading O2 Notify, will provide specific instructions of how to access the evaluation you have been assigned, as well as contact emails if you have difficulty logging in to complete the evaluation. Once you log into O2 with your UAMS username and password, you will see a section on the home screen that says My Evaluations. Any evaluations that are pending your completion will be linked here. I can simply click on the hyperlink and it takes me to a list of my evaluations. Here you can see that I only have one evaluation to complete. This evaluation is a dummy evaluation for a fake student account for demonstration purposes only, but it looks and functions exactly like our actual student performance evaluations. I'm going to go ahead and again click on the hyperlink so that we can view and complete the evaluation together. The first question that you'll see when you open the student evaluation is a question about conflict of interest. If you do have any sort of conflict of interest in evaluating the student, such as previously having treated the student as a patient or some sort of family or financial relationship, if you click yes here, then that is a hard stop and it is not going to allow you to complete the rest of the evaluation. I'm going to go ahead and say no. And that way the rest of our evaluation pops up and we can go over that together. If you have done evaluations for UAMS students in the past, you will notice that this evaluation does look different. It is a new evaluation for the 26-27 academic year. What we have done is really focused more on student communication and professionalism in this evaluation. And less on things like medical knowledge and patient care skills. Those will be assessed in the students' clerkships in different ways. If you will note here that the next questions have the same four choices for each question in terms of answers that you can choose. You can choose does not meet expectations for your student's performance, meets expectations, exceeds expectations, or you can say not observed if you did not observe that particular behavior. If you choose does not meet expectations or exceeds expectations, there is a required comment box that pops up. If I choose the meets expectations choice, I do not have to provide a comment. But if I choose either of the extremes, does not meet expectations or exceeds expectations, then we do ask that you please provide a comment justifying your choice. If I choose not observed, this means that I did not observe the student in this particular behavior, and not observed has no bearing on the student grade. Nothing will be calculated into the student grade for that particular question if you choose not observed. If I choose does not meet expectations, that is the equivalent of giving my student a 50 out of 100 for that particular question. If I choose meets expectations, that is an 80 out of 100. If I choose exceeds expectations, it is a 100 out of 100 for that question. And again, if you choose the extremes, you do need to provide comments as to why you chose that particular choice. For each question, you will see that there is a descriptor of what student behaviors we are looking for when we think about students that do not meet expectations versus meets or exceeds expectations. So you can see here, for instance, for written documentation of the clinical encounter, a student who does not meet expectations, their written documentation is frequently unclear, disorganized, or incomplete. versus a student who meets expectations. Their written notes regularly communicate essential material in an organized way. Or a student who exceeds expectations, their written notes are consistently coherent, concise, and sophisticated. They impart complete information and thought processes behind decisions. So you can see that there's a descriptor of what each student might look like. The first questions are about the student's interpersonal and communication skills. So we've got written documentation and a question about the student's oral or verbal presentations, as well as their interactions with the medical team and with patients and families. Again, you can see that there's a descriptor of each type of student. Does not meet expectations versus meets expectations or exceeds expectations. And again, if I choose the extremes, does not meet or exceeds, I do need to provide a comment versus if I choose meet expectations, there is no comment. Not observed, also no comment box. The next set of questions are about professionalism. So we have a question about accountability, integrity, and respect for persons. And then our question number 9 is a systems-based practice question. This is a question about awareness of outside factors impacting health. And again, you see that there's a descriptor of a student who does not meet expectations versus meets expectations or exceeds expectations. The last set of questions is about practice-based learning and improvement. So how well does a student seek and respond to feedback? And then also, are they able to identify deficiencies and limits and actively seek new knowledge? So again, you'll see that this evaluation focuses significantly more on professionalism and communication and less on patient care skills and medical knowledge. The last 2 questions are comment boxes. Number 12 is a required comment box. These are comments that will go into the student's MSPE or Dean's letter. And so we do ask, please, that these comments be grammatically correct and full sentences. These comments, again, will go directly into the student's MSPE or Dean's letter that they will use for residency application. This is a required comment box. And then the last comment box, or question number 13, is an optional comment box. This is not going to be used in the Dean's letter. This is only for the student to see. And this is where you might include areas that need improvement. Again, things that you would like for your student to see, but you don't necessarily want to go into the Dean's letter. Those can go in this box number 13. If you are finished with your evaluation, you may hit submit. If you start the evaluation but are called away or need to leave and come back to it, you can hit the Save but Don't Submit button. When you look at your evaluation home screen on O2, it will show that you have started the evaluation as the status but have not completed it. You can then go in again and edit it at your convenience. Once you've completed the evaluation and hit submit, it will disappear from your queue. I want to thank you again for all of your help in teaching and mentoring our medical students. We truly could not do this without you. If you have questions, do not hesitate to contact our office at the email addresses listed on the screen. Thank you again.